Pirate medicine and surgery during the golden age of piracy, roughly from 1680 to 1725, was a brutal, desperate business conducted in some of the worst conditions imaginable. The medical practices aboard pirate ships weren't just different from what we have today. They were fundamentally based on a theory that seems completely wrong to modern medicine. Doctors in the 18th century believed that disease came from an imbalance of the four humors, the theory developed by the ancient physician Galen. According to this idea, excess blood was the biggest culprit, the main cause of fever, delirium, and infection. This meant that the solution to almost every medical problem was to let blood. Lots of it. Physicians trained in universities were educated to diagnose illnesses through medicine, while surgeons were actually the ones trained to handle the physical interventions, amputations, and actual surgery. But the hierarchy of medical professionals aboard pirate vessels developed as chaotic. In Britain, there was barely a distinction between physicians and apothecaries, with both convinced they could diagnose and prescribe. Barber surgeons, once respected craftsmen, had been pushed aside by better trained surgeons educated in European colleges of surgery. By the time pirates were sailing the oceans, barber surgeons were mostly relegated to pulling teeth and lancing boils, having lost the complex surgical work to their more accomplished rivals. Amputation was perhaps the most common and most terrifying surgical procedure aboard pirate ships. A cannonball or cutlass wound meant gangrene was coming, and gangrene meant death unless the limb came off. But here's where things get genuinely grim. Before 1718, a leg amputation above the knee was nearly always fatal, not from the surgery itself, but from the patient bleeding to death on the operating table. A French surgeon named Jean-Louis Petit changed everything when he invented the screw tourniquet in 1718. This device, essentially a twisted band of fabric pulled tight by a screw mechanism, could actually stop the bleeding. It was revolutionary. Suddenly, surgeons could perform amputations above the knee and have their patients survive, at least from blood loss. The tourniquet caught on quickly among well-trained surgeons in Europe, but in the colonies and aboard pirate ships, knowledge of this innovation spread slowly. Many surgeons in remote areas either didn't know about it or lacked the proper training to use it correctly. What separated a competent naval surgeon from a poor one was speed. A good surgeon could complete a full leg amputation in considerably less than 2 minutes, often well under. They knew that speed meant survival. The shock of pain was actually more likely to kill a patient than anything else. Patients could go into shock from the trauma of the operation itself, and a swift amputation reduced that window of agony. Yet this obsession with speed sometimes led to crude results. The story of Captain John Phillips perfectly illustrates what happened when a pirate ship had no trained surgeon aboard. Phillips needed his leg amputated, and the crew had to decide who among them was qualified to do the work. After some debate, they selected Thomas Fern, the ship's carpenter, as the most appropriate man for the job. Fern didn't hesitate. He fetched the biggest saw he could find, took Phillips's limb under his arm, and went to work. According to accounts, he separated the leg from the body with remarkable speed, as quickly as he could have cut a wooden board in two. Was it proper surgical technique? Not even close. Did it work? Somehow, yes. Phillips survived this violent amputation, though we can only imagine what kind of stump and recovery he endured. The contrast between Phillips's butchery and what a trained surgeon would do is staggering. A proper amputation involved careful technique, precise cutting, knowledge of anatomy, proper ligature of blood vessels, and proper application of the tourniquet if one was available. But on a desperate pirate ship with no doctor, you got what you got. And if the carpenter could swing a saw faster than a trained surgeon, that was your best option. Bloodletting wasn't reserved just for amputations. It was the cure-all of the era, used to treat nearly every disease imaginable. One medical text from Britain recommended bloodletting for acne, asthma, cancer, cholera, coma, convulsions, diabetes, epilepsy, gangrene, gout, herpes, indigestion, insanity, jaundice, leprosy, ophthalmia, plague, pneumonia, scurvy, smallpox, stroke, tetanus, tuberculosis, and roughly 100 other conditions. That's almost every disease known at the time, treated with the same solution: drain the blood. Leeches were one tool used for this purpose. The preferred leech was the European or medical leech, found throughout Europe until overharvesting at the end of the 18th century nearly drove them to extinction. Women would wade through shallow waters with their skirts gathered, allowing leeches to attach to their legs so they could be collected and sold to physicians and surgeons. When applying a leech, surgeons had to be careful. If you held a leech with your bare hand, it would become reluctant to bite. Instead, you placed it on clean linen, sometimes scarifying the skin first, or applying blood from another creature to encourage the leech to feed. The leech released an anticoagulant called hirud into the bloodstream, which meant that once removed, the bite would continue bleeding for hours, sometimes even days depending on the location. Cupping was another method, a glass cup placed over a wound, pressed down to force out pus and blood, essentially popping a blackhead on a massive scale. All of this bloodletting was based on the humoral theory, yet even in the 18th century, there were physicians questioning it. Thomas Moffat and Cosimo Bonomo had both concluded by 1687 that bloodletting was useless, but their findings didn't match mainstream medicine, though they did gain some followers. The surgeon's workspace aboard a pirate ship was one of the worst places to work in medicine. Space was always a problem, especially during battles. A surgeon would set up a makeshift operating table by placing a board across a pair of chests and covering it with sail, usually positioned on the orlop deck near the bottom of the ship. The cockpit, situated below the waterline where it was safe from cannon fire, served as the surgeon's regular cabin. It was dark, cramped, and constantly damp. The cable tier next to it was packed with thick ropes that took up precious space. A ship at sea never stops rocking, and during storms, the movement becomes violent and unpredictable. Seaman Edward Barlow described a ship in stormy weather as rolling and tumbling, as though some great millstone were rolling up one hill and down another. Performing precision surgery on a deck that's heaving like that was nearly impossible. The surgeon's medicine chest had to contain everything he might need: concoctions, tinctures, ointments, herbs, oils, mercury for the treatment of syphilis, knives, razors, saws, cauterizing irons, forceps, spatulas, syringes, and needles. All of these tools needed to be kept clean and well oiled, yet infection remained a constant threat. The ancient methods of treating wounds still held sway. Each piece of dressing and each procedure had a name and history dating back to Hippocrates or Galen, and surgeons still revered the ancients' wisdom. Wooden prosthetics might be fashioned for lost limbs, and eye patches could be made, but the reality was that infection would likely set in and the patient might lose more than just the initial wound. Pain management during surgery was almost non-existent. Opium and cocaine were both known in the 18th century and especially in the Caribbean, but neither was considered medicinally useful for pain relief for another 100 years. The drug most commonly used was strong spirits, rum or whiskey. Surgeons actually believed that shock itself was the best anesthetic. They thought the shock of the operation would shut down the patient's nervous system and prevent pain. That's why they favored speed, why they wanted to perform amputations quickly after the initial injury. The theory was that the pain of the initial injury would somehow mask or numb the pain of the surgery. It made a certain kind of sense to them, even if it was completely wrong. Suturing wounds wasn't even standard practice in the 18th century. During the late 17th and early 18th centuries, wounds were thought to be places where bad humors gathered and were generated. For a wound to heal, surgeons believed the bad humors had to escape the body. This meant many wounds were intentionally left open to allow these bad humors to drain. Closing a wound with sutures went against this entire theory. You wanted the wound open, weeping, draining the corruption from the body. Only later would the understanding of infection and the importance of proper wound closure change this deadly practice. The surgeons aboard pirate ships came in two varieties: willing and unwilling. Nearly every pirate surgeon mentioned in the historical records appears to have been forced into service. Jacob Morelli was pressed into service aboard George Cusack's ship. John Westby was forced to serve Joseph Bradish's crew. Andrew Wilkie was taken by John Bowen's pirates. These men were professionals who had trained for years, who could expect lucrative careers once they returned to land with their reputation as experienced sea surgeons intact. Pirates simply took what they needed, stealing surgeons from captured merchant vessels and forcing them to join the crew. A few surgeons were willing participants. Alexander Exquemelin learned surgery while working as an indentured servant, assisting an older surgeon. When he fell ill, a kind barber surgeon took him on as an apprentice. After a year, his master offered to free him for 150 pieces of 8. Exquemelin was with Henry Morgan during the sack of Panama in 1671, making him one of the few surgeons to voluntarily serve with pirates and live to tell about it. Rice Whitmire. Chard Brown served as Henry Morgan's surgeon aboard his flagship Oxford and also left records of his experiences. But for most surgeons aboard pirate vessels, the choice wasn't theirs. They were valuable men, too valuable to leave behind when a merchant ship was captured. A ship without a surgeon faced disaster. Infections would spread, wounded men would die from preventable causes, and the crew's ability to fight and function would deteriorate rapidly. Thank you very much for watching this video. If you learned something new about pirate medicine and surgery, make sure to leave a like and drop a comment down below with your thoughts. Subscribe to the channel if you'd like to see more videos about pirate history and life at sea during the Golden Age. Thank you again, and I'll see you in the next video.